I'm Kristy Racz, Director of Clinical Education and Physical Therapist in Cedar Knolls. There are many factors to ensure a positive outcome with an ACL surgery. Chronic versus acute injury, type of graft, traumatic or non-contact, and level of fitness are all factors that can shape the early phases of rehab. In the following case, a woman in her 30s had her second ACL revision on April 6, 2023. She was very active before the surgery, had great strength and range of motion, and she's very familiar with the rehab process. Today she is in for her 5th visit, 20 days after surgery.
For early post-op surgical knee patients, I recommend using a compression sleeve to help with swelling. Excessive swelling will diminish the contraction of the quadriceps and delay this early phase. Regaining active knee extension is paramount for all knee surgeries. It ensures that the quadriceps muscle can fully contract, stabilize the kneecap, and promote a normal walking pattern. A patient needs full active knee extension in a non-weight-bearing position, but more importantly, to have this motion when standing and full weight bearing through the affected leg. Table exercises include quad sets and the use of neuromuscular electric stimulation that will help with initiating quad contractions. It is important to cue the heel pop to focus on quad activation rather than hip flexion. However, once a patient has good contraction and full extension in standing, it is time to advance. The sled push, retro treadmill walk, and cable column knee extension exercises are great examples of closed chain quadriceps strengthening that can and should be used in early phases of rehab.
Regaining knee flexion is crucial in the early phase of ACL reconstruction surgery. Heel slides, prone quad stretching, double knee to chest, and riding the stationary bike are great exercises to start early on in this phase.
It is never too early to focus on the lateral hip, primarily the glute medius and maximus. Often, ACL injuries occur due to a lateral cutting movement or blow to the outside of the knee. These muscles may have been weak and unable to stabilize the knee properly, leading to injury. Lateral step-ups, lateral walks, side-lying hip abduction, side planks, clamshells, and standing cable column hip abductions are necessary in the first few weeks when treating a patient after an ACL surgery. In addition to the glutes, core exercises should be initiated within the first few sessions following an ACL reconstruction and be given in a home program. Restoring a normal gait pattern is one of the goals in early post-op ACL rehab. Achieving full knee extension is needed for a proper heel strike every time the affected leg hits the ground. The anterior tibialis muscle contracts eccentrically on heel strike and helps to allow for a smooth weight transfer from the heels to the toe. The standing ankle dorsiflexion exercise with support is a great weight-bearing exercise to strengthen both the anterior tib while promoting knee extension. Also strengthening the soleus, a calf plantar flexor that works when the knee is flexed, is very important in early ACL rehab. A strong soleus assists with the gait cycle and resists anterior shearing forces on the ACL. Seated calf raises are a safe way to introduce this muscle group early on in the post-op protocol.
Lastly, a great addition to early phase ACL surgery rehab is using the blood flow restriction cuffs. The BFR cuffs occlude 100% of the venous flow and up to 80% of the arterial flow. A patient will have the cuff on the top of their limb and perform several exercises with it.
The restriction allows a patient to fatigue the muscle as if there is a much larger weight on the leg and gain the same benefit as if he or she is pushing near a maximal load. When the cuff is removed, there is no residual soreness or delayed onset of muscle fatigue the next day. BFR is allowing patients to regain strength faster and load the muscle, especially if they are non-weight bearing. Thanks for following along with this presentation on early post-op ACL rehab. If you have any questions or concerns, reach out to the professional development team via email and we can discuss.